Hello, Dr. Vicki Peterson here. I want to talk to you today about a study out of Italy, and they looked at over 770 patients that were diagnosed with celiac disease over a 15-year period. So it was a good number of patients, and they were looking at the characteristics of how these celiac patients presented themselves, as well as what their testing revealed. And it was very good for a number of reasons. Number one was 50% of the patients diagnosed with celiac disease had digestive complaints. You might have expected that to be higher. That's definitely, I think, one of the major reasons why we don't diagnose enough of our celiacs. I mean, at best, we diagnose maybe 5 to 7% of those suffering from celiac disease, at least in this country. And one of the reasons is that we kind of anticipate that the digestive problems will be very dramatic, very severe, and definitely ever present. And in this group of almost 1,000 people, only 50% of them had digestive complaints. Those with non-digestive complaints complained of things like osteoporosis, anemia, headaches, frequent miscarriages, allergic reactions, elevated liver enzymes. Am I forgetting anything? Headaches, if I didn't say that, and that was it. So that was the other 50%. So, you know, when a woman is suffering from miscarriages, does her OBGYN immediately think to test her for celiac disease? Or with the ever-increasing number of patients suffering from fatty liver disease, or being told on your annual physical that, oh, there's a little elevation in some of your liver enzymes, we're just going to watch and wait and see how that goes, you know, over the next year or the next 6 months. And often patients are told with liver issues, especially elevated enzymes, well, just cut your alcohol intake. Some of these people don't even drink alcohol or drink very little, and that's not the root cause. It's actually celiac disease. Headaches, allergic reactions. So these are things that you don't necessarily immediately jump to a celiac diagnosis, but this research points to the fact that these are the extra-intestinal, meaning outside the digestive tract symptoms, that really should be a red flag or a warning signal that we should look for celiac disease as a potential root cause reason. And that's really what it's all about, no matter what kind of health condition you have, is getting to that underlying root cause of what's really going on. And it's not always gluten, certainly. I certainly speak about gluten a lot because it's so poorly diagnosed in this country, but really what I'm about, what my clinic's about, is get to that underlying root cause of why you have whatever symptom you have, because there's always a reason. You don't just have a symptom for no good reason. Getting back to the study for a moment, they also found that while the majority of patients had villous atrophy, meaning the degradation of the lining of the small intestine, 12.5%, a decent percentage, had no villous atrophy. They had some inflammation in their intestines, which is abnormal, which we also see in gluten sensitivity, but despite the fact that they definitely had celiac disease, they did not have villous atrophy. And that's important because, unfortunately, some gastroenterologists in this country are still stuck in this concept that without villous atrophy, there's no way someone could have celiac disease, which has been disproven, but this study added some credence to that as well. And 80% of the patients in the study were symptomatic, meaning they had symptoms they were complaining of. But that means 20% of them didn't. And that's a tough one, and it's not one that I think we should necessarily spend a lot of time on, because you're not going to take every asymptomatic person who's feeling great. I don't know if they were feeling great, but they weren't complaining, and then test them for celiac disease. I think our efforts and money are better spent in trying to find out why people are not feeling well. But it is interesting to note that 20% of these individuals were not complaining of anything, and maybe they were just people who didn't like to complain, or they literally felt fine. Usually I find that patients who say, yeah, there's not much going on, when you dig a little, you can find things that are not normal, even though they weren't initially complaining. So that was the study. I think it is important for a number of reasons, as far as really looking at 50-50 breakdown between digestive symptoms and non-digestive symptoms, and the fact that not all these patients had villous atrophy. So that's my takeaway, and I think the most important thing is to know that when you have a symptom, when your body's not feeling well, there's a reason. And find a clinician who will help you get to that reason. And don't let them foist it off on you're getting older, or it's all in your head, and are you depressed, or some nonsense like that. I'm not saying depression is nonsense, that's a symptom. But when you're not feeling well, and you're not complaining of depression, and you're just saying, doctor, 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 help me, and you keep going back to the doctor, and finally the doctor says, well, you know, are you depressed? It's like, who wouldn't be depressed that their doctor can't find the reason for their symptoms, which had nothing to do with depression in the beginning? I hope I'm not confusing you what I'm trying to say here. But in other words, getting anxious or getting moody or getting depressed about the fact that your doctor can't help you is very different than coming in with clinical depression, you see, which of course has a root cause in and of itself. But the reason I'm bringing this up is that too often, at least in this country, when a doctor can't find the answer for someone's problems, they try to then insinuate or try to kind of foist off on the patient a diagnosis of, gee, you know, maybe it's just depression, and maybe you need a medication to suppress your depression that the person never really was even complaining with, and that gets me upset. So I hope I made that clear, and the real message that I want to say is that there's a reason for your symptoms, and find a clinician that will help you get to that root cause. And if you can't find that clinician, let me know, and I'm here to help. And so that's what I would like to share, and until next time, I wish you very good health.